Hello, everybody. I'm giving this presentation to my co-workers, who are other physical therapists and physical therapist assistants. This is a review of a study I ended up doing called Manual Therapy Interventions in the Treatment of Plantar Fasciitis, a comparison of three approaches. The three approaches that these researchers ended up doing in 2019, the researchers are Christopher Yelverston, Sumani Rama, and Bernard Zipfel. They ended up kind of looking at three different techniques that ended up treating plantar fasciitis. The first technique was where they ended up using mobilizations and manipulations along with cross-fiber tissue massage in order to see how that ended up treating plantar fasciitis. Group 2 ended up receiving stretches along with the cross-fiber massage, and when I say stretches, I mean calf stretches, so the gastrocnemius complex in terms of stretching that guy out. They were stretching it out for 3 times a day for 30 seconds. And then the third group actually ended up combining both of those. So the third group ended up receiving the stretches and the mobilizations and manipulations. I would like to end up saying that this research was done by a university and their chiropractic clinic. So it's very kind of chiropractic bias in a lot of ways, and I'll explain that a little bit more here in a bit. In terms of the type of study, it was a random control study, comparison study, and what they ended up finding out was that kind of all three of these groups ended up having some kind of benefit. But the group that ended up having the most benefit, in my opinion, and based off of the data, was Group 2, which was just the stretching and the cross-fiber tissue massage. So all three of the groups ended up having the cross-fiber tissue massage. The difference was the mobilizations or the stretching, and Group 2 did the best without any of the mobilizations or manipulations. Because of that, I think there was a little bit of a bias in this study. Once again, it was kind of done by some chiropractic group, and they kind of glimpsed over it in terms of their conclusions. They just ended up saying that all of them were beneficial in some capacity, and didn't really end up actually comparing them like they ended up saying them, like they maybe suggest they do in the title of their article. But it's very safe to say, based off the data that they ended up giving, which I thought was very kind of thorough in terms of their methodology, that it was weird that they didn't actually make those comparisons. And I think it was just because, physical therapy focuses more on the stretching and the mechanical stuff that's going on in the lower extremity to kind of deal with this stuff, as opposed to just manipulations. And since the research ended up showing that the manipulations really didn't do anything significant compared to just the stretching, I think it was kind of glimpsed over, because they don't want to kind of hear that stuff, right? So anyway, that was a little bit of the bias that I ended up encountering with this one. Some of the other things was just low sample size and that sort of thing. But this was kind of an interesting study, and I think I would end up incorporating into my physical therapy practice because the research was pretty sound throughout the entire article and the study. And so I think I would end up incorporating at least the cross-tissue massage along with the stretching. Stretching is done with plantar fasciitis no matter who you are, in terms of physical therapy stuff. But I would definitely incorporate the cross-tissue massage in terms of dealing with plantar fasciitis, just because it showed such good benefits in this particular study. And I think that's relevant to all my coworkers because we get so many people that have plantar fasciitis. It's one of the most common musculoskeletal issues that we end up seeing, and plus we end up getting a lot of podiatrists referring to our particular clinic, and so it's really important to be able to treat these people and get them through and better as quickly as we possibly can. All right, thank you for listening. Have a good day.